Hi, my name is Darien Beall, and I did my practicum with Allegheny County Health Department's Overdose Surveillance Group. Most of my internship was tackling how to best analyze the effects of the current pandemic on a vulnerable population, specifically those with opioid use disorder. Temporary policies have made some substance use disorder treatments more accessible, such as easier access to medication. However, these policy changes may not have been enough to curb the isolating effects of the pandemic. The Overdose Surveillance Group decided that we would get a closer look at more effects by using qualitative data as opposed to just capturing death numbers. By using qualitative data, we may be able to see the specific ways in which individuals facing substance use disorders were affected by the COVID-19 pandemic. Further, these are ways that may be impacting those who would be overlooked if they only experienced non fatal overdoses. The qualitative data used were death narratives, which are reports already sent to the health department. Death narratives are qualitative forms discussing details on fatal overdoses. They originate with a 911 call. When first responders arrive on scene, they list the date, time, and nature of the call. Specialized overdose related investigators analyze the scene and add onto the narrative with their perspective. If a decedent went to the hospital, the narrative would include the events that took place there. The medical examiner's office will list autopsy results such as the cause of death. Lastly, they list the process of finding the legal next of kin, notifying them of the fatal event, and obtaining personal history of the decedent. The process ends when Allegheny County Medical Examiner's Office sends the death narratives to the health department. So we decided that to assess the data and trends of overdose-related activity, we would read the reports and track the frequency of key terms that we thought were important intersections between the epidemic and the pandemic. Some key terms included mentions of housing insecurity, medication-assisted treatment, quarantine, and naloxone administration. Then we started reading. Feel free to read the example narrative listed here in the middle of the page. I do want to warn that some of the details can be gruesome and uncomfortable. However, this is a fictional yet accurate depiction of what the narratives looked like. I have the key terms here listed in blue. We can see that in this case, they mention that naloxone was administered by a friend, the decedent went to the methadone clinic for a prescription, they were afforded a larger amount of methadone due to the pandemic policies, and the decedent's personal history included the criminal justice system. All in all, we received 465 fatal overdose death narratives for 2020. The dates ranged from January 1st to November 10th. Anything after November 10th was not fully completed and thus not sent to us yet. Trends that we observed were that Allegheny County's preliminary number of overdose deaths was higher in 2020 than in 2019 by at least 64 deaths. This number will increase as we receive more reports. Further, we divided 2020 by the preventative restriction phases, red, yellow, and green. We found that the red phase, which was the most restrictive, had approximately 2 deaths per day, which was higher than any other phase. In the future, we will dissect 2019 fatal overdose deaths narratives in the same way and use it as a comparator to have more days in the sample and more opportunity to gather what the data looked like pre-pandemic. These terms give value to the qualitative data from death narratives. They help us determine what effects of the pandemic were on those with opioid use disorder and what ways they were affected. Lastly, they may convey what may still be currently affecting those with opioid use disorder in the wake of disasters. Thank you for watching.